So I'd just like to introduce Nurse Varley to you all and say thank you very much for joining us today. And I will hand over to you to tell us more about the cancer rehabilitation process and why it's so important and what difference it can make to people with cancer, if that's okay.
Yeah. Okay, thank you for inviting me here today. As I said, my name is Gail Varley. I'm the Cancer Rehabilitation Clinical Nurse Specialist at the Royal Berkshire Hospital. I say reasonably new to the post. I've been in post since November of last year, but I do have quite a long history in the cancer care setting, having previously been a colorectal nurse specialist and a chemotherapy nurse along my cancer journey as well. Okay, so I wanted to start by saying rehabilitation, what's the definition? So I looked that up in the Oxford English Dictionary, and it came up with the process of helping somebody to return to normal, to a normal, healthy life after they have been in prison or very ill, which I thought was quite a very opposite ends of the rehabilitation definition. But there you go, that's what the Oxford English Dictionary defines rehabilitation as. And I know sometimes it can be a little bit of a woolly title, and that people don't understand what it is in the cancer setting. It's probably thought more of sort of rehab within maybe orthopedics or cardiac, but it's now very prominent within the cancer setting, rehabilitation as well. So who are we in the cancer rehab team? And we're a really small team. And if you think, I joined the team in November, so it was an even smaller team before that. So Emma Hogbin, who people may know, is the lead nurse specialist within the team. And then Jane Bond, who you may well know as well. We've come across, I think she's spoken previously at this session. Myself and Marina, who is our clinical support worker. So why is rehab important to our cancer patients? Well, it's estimated, and this quote is 2017, so we are almost 6 years on from that 2.5 million people living in the UK today have had a cancer diagnosis, and half of them will live for at least 10 years and more. And many cancer patients experience impairments in everyday living as a result of the adverse effects associated with their treatment as they reach the terminal stage of the disease or ongoing beyond their cancer diagnosis. So rehabilitation may play a role as an approach to maintaining and improving the quality of their life. So why is it important? The impact of cancer often doesn't end when the treatment does. Everyone should be supported to live as well as possible for as long as possible. And that's certainly what I've noticed since I've come into this post, that patients finish their treatment and everybody thinks that's great and they think that's great, but actually a lot of the psychological aspect of their diagnosis comes into play after they've finished the treatment. And it's estimated that by 2028, 55,000 more people each year will survive their cancer for at least 5 years after their diagnosis. So what is cancer rehabilitation? So it supports people, so cancer rehab within Berkshire, it supports people to live well beyond cancer, using a range of tools and opportunities that can enhance their recovery and improve their ability to tackle tomorrow. And it's available for all patients who have received cancer care at the Royal Berkshire Foundation Trust. And sometimes that can then go into sort of Buckinghamshire, or I know the county's sort of divided to East and West Herts a little bit, but if a lot of patients come maybe from outside in Buckinghamshire to get radiotherapy at Bracknell, so they are also entitled to come to our cancer rehab team or be referred to us. So who can refer to the cancer rehab team? Well, anyone can really, and patients can self-refer as well. I've just put a few people here that would refer. So the CNSE, so that's your specialist, your clinical nurse specialist from the site, the tumour site that you're under, so breast, bowel, whoever. Your consultant can refer you, and we do, I think I'd say the CNSEs and the consultants are the highest referrers into our team. That your GP can refer you, and you can self-refer. And actually this week, I think I've spoken to at least 3 patients who've self-referred themselves to our service. Social prescribers are also refer on, and again this week I've had a patient who was referred from a lymphedema nurse, so she's gone there for some treatment and she's opened up to a lymphedema nurse, and they've referred her on, and some pharmacists, because I know in the trust Some patients are reviewed when they're on sort of maintenance treatment, and they're reviewed by pharmacists, so the pharmacist can also then refer on. So what do we offer? So we offer a plethora of things, and I'll sort of go through briefly, and I'll show you what we do offer. What I like to say to patients is that we have a bespoke service, because not one thing fits all. Everybody likes something slightly different. Some people like groups, some people like one-to-one. We now do virtual sessions. So I'll start with, we do CNS one-to-one, so we get a lot of referrals for psychological support, and people may think then that's straight to the psychology team, but a lot of the times that can be actually, a lot of that can be covered with a one-to-one session with the CNS team, the rehab team. And I think certainly over the last 3 years, so much has been done by telephone, and follow-ups are done by telephone. We had to go straight into telephones and virtual things. So patients really like that one-to-one time, and just to have that hour blocked out. And it's time that we have, that's part of our role. So it's great to be able to give patients that time to just talk, speak, let them, say things. Our usual thing is that we don't want to speak to our family and friends, so it's good to speak to somebody who's quite impartial. We run an enhanced supportive care clinic, and that's weekly, and that's run by us, the rehab CNSs, and a palliative care consultant. And the purpose of that clinic is for patients who don't have a curative disease, who aren't at end of life by any means, or are living well with the disease, but it allows them to come in and speak about any symptoms they have, or what the next what the future holds, and what to expect possibly with the disease. We run take control workshops, and these are run monthly between Reading and Bracknell, and we discuss, so that's a one-off workshop that patients come to, and we discuss topics including fatigue, sleep, psychological impact of cancer, physical activity, diet, psychosexual issues, and we do lots of relaxation and mindfulness sessions within that. And we've also got a virtual health and wellbeing sessions, and we run them 2 or 3 times a month on our sort of rolling programme. And my next slide shows you the topics that we cover in that, so I'll wait and show you that. And then we've got a psychological team within the rehab team. So we have got 3 clinical psychologists who work within the cancer setting, and they offer 6 sessions per patient with a psychologist, and they can refer also to talk. And we also can refer to talking therapies. Millen run a counselling session, but a counselling service, and it's Macmillan BIPA counselling. And the other things we do, we signpost, and we give information, onward referrals to befriending, complementary therapies. You may have heard of My Cancer, My Choices, and that's very popular. We do a lot of referrals to them. Citizen Advice Bureau, certainly a lot more financial demands on patients nowadays, with coming to hospital often. Cancer Champions, and there's quite a wide exercise classes available within the area for patients. And this is our virtual timetable. So you might be able to see it slightly better than I can, but we've got like a plethora. We had this clinical psychologist do a talk just yesterday, and we cover numerous different topics, as you can see on the screen, and I can certainly share my slides with you afterwards if you want to look at that. And that's just our take control workshop flyer explaining what we do with that. And this is what one of our take control workshops looks like. So that's Emma in the background there, and it looks formal with the desks there, but it's a very informal session. We tend to get about 8 patients that come to that, and it's it's a very structured event, and it's very well received, and we get really positive feedback from it, which is good. I don't know if anyone has managed to get to one of those sessions.
No.
And that's our signposting as well. So that's I've just put some of the leaflets that we've got there that we can source. I'm still learning as well what's available in the county, so lots of things. And the next couple of slides I had was just who's been referred, and how many referrals we get, and that's up to 80 referrals a month, back in March that we're getting. So as our team grows, our patient workload grows. I've got that there in blue as a rehab, but we're looking at introducing prehab now I'm not going into that today, but it's very much the new thing that we're looking at, which will expand our team. So we know that rehab is good for the well-being of patients during treatment and then beyond treatment. But we also know that prehab is very important for patients who are going to have treatment. And certainly in the colorectal setting, there can be quite gaps between having maybe radiotherapy before surgery, and it's then getting those patients engaged with physios and with dietitians to ensure that they're optimizing themselves in readiness for treatment, because we know that as being as well as you can be prior to certainly quite radical surgery is really important. So that slide there just shows that we're now starting to dip our toes into the prehab setting, and we're currently just waiting for sort of confirmation that we may be able to expand our team to include that. We don't have the capacity to do both at the moment, but that's something that we're certainly looking into. And that's just, you know, another sort of what our patients are doing. And see, as you can see in that slide, CNS's 1-to-1 is really high. The take control and the virtual sessions are very well attended as well. And prehab is kicking in there too. And how you contact us, or you can email the Cancer Rehabilitation Team on the email there, and you can call us as well there. And we're trying to enter into the 21st century. That's a QR code for our team leaflet. And we're also just got our Twitter page and our a Facebook page. So we're hoping to sort of advertise our services a little bit more on some social media platforms.
Cancer Rehabilitation is a specialist NHS service which helps people affected by cancer to self-manage and live well. People tell us they have concerns with fatigue, being less physically and socially active, weight management, staying in work, stress and anxiety, and fear of the future. Cancer Rehabilitation empowers people to take back control by giving them the knowledge, skills and confidence to self-manage their concerns. We provide group and one-to-one sessions for patients and carers to help people identify the physical, practical and emotional consequences of their cancer and treatment.
I was diagnosed almost a year ago with breast cancer. I was feeling lost, abandoned, really didn't know the road forward. When we came to take control, it was a relief for us both to find that people felt the same as we felt, that we weren't failing each other, that this is how it goes, and everybody was feeling the same. And that in itself gave us a starting point. We were in a situation where we needed help. I don't know where we would be if we hadn't had that, but I can't praise it enough.
I was offered the Take Control course, which I attended. Found it very helpful. You tend to feel a bit down when you're recovering, and this enabled me to understand where all those feelings were coming from, and to be able to, as it says, take control. I've, if you like, been involved in military music for probably 50 years or more. Whilst in the recovery ward, I sent my pipe major an email saying I'm probably going to have to retire from it, and they wouldn't accept that. And I'm pleased that along the way, Take Control has shown me that it isn't the end. You get back to normal as quickly as you physically can. I feel personally that it's very important to get involved. I know it's benefited me, not just by taking control of your life as it was, but dietary needs and financial needs. All the advice that you need is available.
So when all the main treatment calmed down, then I had the realisation of the enormity of what had just happened, and I felt very lonely, lost, down, and the programme took my hand at that point and guided me through that really, really difficult time. I feel really positive about the future now. I can also manage those negative emotions.
Well, I think cancer rehabilitation for me means being picked up at the end of your major treatment, be that an operation or in my case radiotherapy, and being shown there is a path through which you can regain your zest for life, and you can make some improvements to your diet and get some exercise in there. And believe me, you'll feel so much better if you can do all those things.
I remember the very last day of my chemotherapy, coming out of the hospital and whooping like this, and felt, oh, this is fantastic, I'm there. And then what? Having been a fairly confident person, my confidence was just shattered. And I was obviously quite weak as well. Cancer rehabilitation for me has been empowering, enriching, energising. It was just a very, very positive experience.
I'm now able to do all the activities that I thought I might not be able to do, and I'm able to really enjoy life.
Taken as a whole, it just makes you feel a whole heap better. Plus, you get the motivational benefits of being in a little team, teeing each other up.
Attending these programs is one of the best things I've ever done. It brought me back in control of my life.